More than 500,000 people living in Toronto do not have a family doctor. This is according to the Ontario College of Family Physicians. Forecasts show that number could reach nearly 1 million by 2026, with many doctors expected to retire in the coming years. There aren't enough doctors who are choosing family medicine to replace them. Across the province, over 2 million people are without a family doctor. That could double to 4.4 million patients by 2026. Joining us now is one of our favorite family doctors, Dr. Allan Grill. He's the Chief of Family Medicine at Markham-Stouffville Hospital. Dr. Grill, good morning to you. So these numbers really staggering. What does it tell you? Why do we have this major shortage of family practitioners?
Good morning, Marcia. Always a pleasure to be here. Yeah, we're experiencing a crisis right now in family medicine and primary care in Ontario. And the numbers that you just quoted, the 2.3 million people that are unattached and don't have a family doctor. And it's estimated that that will be 1 in 4 Ontarians by 2026. I think there are 3 factors that have led to this. The first one is there's a huge administrative burden facing family physicians right now. I mean, we were trained to see patients. We love seeing patients. I love the relationship I have, birth to grave, with all of my patients, helping prevent illnesses, treat illnesses, etc. But the average family physician is spending 19 hours a week on administrative work. That's filling out, unnecessary sick notes when people have colds and their employer wants them to get a note, tracking down referrals when specialists who are also very busy can't see a patient. We're competing with each other to get our patients in. We'd much rather be sitting in front of a patient, spending our time with them, than spending 19 hours after our workday. That's number one. Number two, there isn't enough team-based care support. Only 30% of patients in Ontario have access to a team. That's a family physician, social worker, pharmacist, dietitian. I work at a family health team in Markham. It's incredible when I'm able to share the patient load with my colleagues. That opens up time in my schedule to not only accept new patients, but give more time to my complex patients, get them in earlier. Most other people in the province don't have access to this, and when they're offered access, they have to pay for it, which is very unfortunate from an equity point of view. And finally, the compensation model has not kept up with cost of living. I don't think family physicians are complaining that they don't make a good living. We're very happy and privileged to be doing what we're doing. But expenses like staffing, rent, supplies, all of those things are going up similar to other professions. And yet our compensation package that we get from the Ministry of Health has really not increased. It's making it more challenging to run an office, more challenging to meet patient needs. And what scares me the most is we're having trouble recruiting medical students to go into family medicine and family medicine residents from doing comprehensive practice that patients really need.
Yeah, there's a lot there. So, Dr. Grill, we know from covering this story that the lack of a family doctor has major consequences. It puts a strain on the healthcare system. We've got people going to the ER for things that perhaps they shouldn't be going to because they don't have a doctor to go to.
Yeah, it's unbelievable the unintended consequences of having so many unattached patients. So number one, we can't give them preventative care. Where are they going to get their vaccines? I mean, we've got a rise in measles cases right now. We need people that need catching up. Where are they going to go? They don't have a family doctor, becomes much more challenging. Cancer screening, right? We've seen rises in cancer rates, specifically because of the pandemic when people fell behind on screening. Even with the provincial programs in Ontario, it becomes much more of a challenge to navigate the system, get that test in an appropriate period of time. And then there's all these people with chronic illnesses. If they're not being followed regularly by someone who knows them, has built a relationship with them, their disease goes unchecked, then they present with worsening symptoms. They need more complex treatments. It costs the system more money. And then the final point you made, where do they go when they can't get care? They go to the Emerge. My Emerge colleagues are working very hard just to deal with the urgent issues, to add all of these other unnecessary visits because people don't have access to primary care. It's a real shame. And I have to tell you, at the end of the day, our patient is our number one client. And Ontarians should not stand for this. They should not feel that this is the standard we're looking for. And they should speak to their MPs and their MPPs about what their plan is to deal with this access problem.
Dr. Grill, we're going to have to leave it there for today. Thank you so much. Dr. Allan Grill is the Chief of Family Medicine at Markham-Stouffville Hospital.